Welcome to Holographic Health Insights, the podcast where science meets soul for complete well-being. Join hosts Reverend Anne-Marie Byers and her daughter Rochelle Generis as they explore transformative health approaches that integrate body, mind, and spirit, from energy medicine to holistic practices.
Holistic care thrives when paired with clarity. Let's explore how diagnosis supports alternative medicine. Welcome back, everybody. Skip Monty back in the studio, co-host and producer, back in the studio with owners of Holographic Health, Inc., Reverend Anne-Marie Byers and Rochelle Generis. Ladies, good to see you again. How you doing?
Wonderful, Skip. How about you?
I'm doing just fine. Rochelle, you doing all right?
Doing well, thank you.
Very good, very good. Well, let's go ahead and dive right in. Let's tell our listeners, why is a standard diagnosis helpful in alternative medicine?
So sometimes we'll go through our testing like we've talked about in previous episodes, and we either aren't very clear with what exactly is going on, or there's just some kind of discrepancy maybe. And a lot of times, or we've seen, Ann and I've seen, when we can get a specific diagnosis to help us tailor a holopathic to that specific person's issue, it can work a lot faster and be a lot more helpful in supporting eliminating that imbalance from their body. So sometimes our testing works great, and sometimes we just need a little more clarity. And that's where a medical doctor can do some tests and give us a clear diagnosis, whether it's from a biopsy or a blood test or blood work, to really let us know, or even sometimes confirm what we're suspecting, to help support the people who come see us into balancing their health and their issues. I know Anne has had two specific situations come up with dear friends of ours that I'm sure she'll talk a little bit about. But it just can help us refine our testing and get some clarity when things might not be as clear, or maybe we're questioning what our testing is showing, because sometimes there's a lot going on and people are complicated things.
Yeah, and some of what we do is, we have a collection of energy signatures that we test with. We test the circuits in the body to see what is weak, and then where it might be missing something, or it's something just isn't right in that circuit in the body. And we also test for specific conditions, etc., where there is a electrical or you know, imbalance in the body. And so that's what we're looking for. And if I'm familiar with a certain condition, if I've worked with people before with that condition, I'm more attuned to that. I can test for that a lot easier. But when you have a severe condition, a biopsy, for example, Dr. Barudi always told me to use a specific wording in that biopsy for the holopathic tailored to that person and that condition, because that goes in like a sniper and targets that condition right where it is in the body. Otherwise, it's kind of like a general antibiotic you would take, or a general, vitamin C that you would take to stay healthy. It's not like a sniper that goes in and targets that condition where it's living. So I had a really good friend that was not well, and she wanted to use alternative therapies only. And I kept testing, finding strange results, things I hadn't seen before. And it turned out that she had a certain kind of leukemia. And so I could only help her generally. I couldn't target that because I did not have the specific diagnosis from from the doctors to really target how we could help her non-traditionally. And sometimes, as much as we all want to use natural therapies, the first bout that I had with a cancer imbalance, I had a tumor in my neck that no matter what I did, I could not get it to go away. And where it was pressing on the vagus nerve, and it was making me anxious, it was making me nauseous, it was making me lightheaded, and I really didn't even have Holographic Health at that time. This was before Holographic Health found me or I found it. And so it became necessary to have the surgery to have that removed, and then later on, I could take that biopsy that I had had to better work with my body to keep that at bay. And so when we have a diagnosis of what is really going on, we can help people determine the foods they should eat to support their body and body systems and that organ, gland, whatever it is. We can create a holopathic and look at our supplements and say, okay, this will help your body to be stronger to fight that condition. And we had recently, I had another good friend and someone about Rochelle's age actually, who contacted me and said, I have some really s- swollen and sore lymph nodes. And so I did some testing, and what I found were lymph vessels and liver. And it turned out that she actually had a severe liver imbalance, had actually developed cirrhosis of the liver, and really needed medical intervention. And so I encouraged her immediately when I saw her to go see her doctor, get some blood work, and see what direction she should follow medically, as well as utilizing our techniques to support her body in its healing. So these are just some cases, my own, in fact, as well, and friends that we have had and clients also over the years who have benefited greatly from seeking medical help. And as I've always said, whatever the doctor tells you is not gospel. If they suggest a therapy that you don't feel comfortable about, do your own research, pray about it, talk to God about it, and determine what you feel you should do. I've had doctors suggest that I do chemotherapy after I had my uh, tumor removed, etc. I did research. I determined from a logical standpoint, first of all, it didn't feel right to me. And so I logically then went in and did some research about that in conjunction with the type of diagnosis I had. And there was very little payback for utilizing chemotherapy. And there was also a lot of risk, a lot of negative implications to do that. And so I really encourage people to do their own research about the therapies, the radiation, the chemotherapy, etc., and look at what the side effects are, because they all have side effects. And if you determine you want to work with us and do that as well, we're just here to help you to have the best life, whatever your decisions are. But we also have people who have decided that those side effects are too great for them. They want the quality of life, whatever length of time they have left. And we honor that, whatever that is. We have people that are holding their own with severe conditions because they are really doing the work to minimize the side effects. Sometimes they're using a drug therapy, but they're also, some of them choose to only do natural therapies with us and other people. And the idea there is to support the body nutritionally, to work with whatever your challenges are, whether they're physical, emotional, etc., and then have the best quality of life that you can. And that's what we're here to help people do. So we never advocate that you just say goodbye to your doctor. Doctors are a good resource. The diagnoses are really excellent and just imperative to helping get down the road. And certain things like certain skin cancers and tumors and things like that. Had a good friend that also had a skin cancer removed just this week and asked for some support to help get back on track afterwards. And that is the kind of work we do as well.
Wow. Very good. Well, obviously, a diagnosis is super important in order to effectively use alternative medicine. But are there risks when alternate care is pursued? Or is there ever a risk when alternate care is pursued without a clear medical diagnosis?
I mean, the risk of not progressing if something goes undiagnosed or undetermined. Um, or sometimes, just as an example, with holographic health methods, we may get close, we may get pretty close, but things could be a lot more beneficial for that body with a clear-cut diagnosis. There's sometimes, like Ann said, there's a general treatment for a lot of things, but then when you have a specific diagnosis, especially if it is severe, knowing exactly what you're working with can often help all of your providers support your body on its journey back to health. So it really, especially with severe diagnoses, I think it is almost imperative to get a clear diagnosis. If it's just, oh, I've got this ache in my hip, or, I probably have something out of place, that's not, that's a general ache and pain. But if you have something that often we see as life-threatening and really interfering with quality of life, it does not hurt to have a team behind you working with you and trying to help, support your body back to health. But we definitely do love a team approach. I don't ever put all of my trust in one basket. I like to have multiple people, kind of looking at things and helping me think through things and think through options, because there's always another option, or multiple options on the table. So that's what I like to use and encourage people to do as well, is, talk with multiple people. Second opinions are great. Third opinions are great. And sometimes it takes a fourth opinion to really find out what the actual issue is. So
the most important thing for any person facing any medical challenge is that you have choice. It is your body, and you need to talk with your family, with God, and make the best decision for you, because there's so many options and it's your life. And so do your research, decide accordingly.
Well, ladies, I can't tell you how much I appreciate you explaining how important diagnosis is and how it strengthens the effectiveness of alternative medicine by giving it structure and direction. So thank you again, and we will see you guys in the next episode.
Thanks for joining us on Holographic Health Insights. If you're ready to dive deeper into transformative health approaches, visit holographichealth.com or give us a call at 800-566-1522. Remember, your journey to total well-being starts here.